Okay, good afternoon, everyone. Thank you for joining us here at the UConn Center for mHealth and Social Media for a webinar today talking about an overview of methods for capturing and examining social media data for health research. My name is Dr. Molly Waring, and I am an assistant professor in the Department of Allied Health Sciences and the director of the Methodology Core here at the UConn Center for mHealth and Social Media. I'd like to apologize in advance for coughing during this webinar. I have a cough and a chest cold, and so I will try to minimize coughing, but I apologize for interrupting when I do. So today, we're going to be talking, as the title implies, about methods for collecting data and analyzing data from social media platforms. And we're going to be talking about considerations related to study design, research topic, social media platform, ethical considerations, and composition of the research team. First I'd like to start by talking a little bit about what is social media. If you're here and you're listening, you're obviously interested in social media. So social media is defined as forms of electronic communication, such as websites for social networking and microblogging, through which users can create online communities to share information, ideas, personal messages, and other content such as videos. So here on the screen I have the logos or the little images of several common social media platforms, including Twitter, Facebook, Instagram, LinkedIn, Reddit, Pinterest, YouTube, Snapchat, and WhatsApp. So currently the majority of U.S. adults use social media, including 73% of which engage on multiple platforms, and most users engage daily. So here we have two graphs from recent research from the Pew Research Center, showing on the left side of the screen the percent of U.S. adults by age group who use 5 common social media platforms, and then on the right the percent of users who engage daily on these platforms. So currently the vast majority of adults under the age of 65 use YouTube. A lot of this use is viewing videos rather than creating their own content, but the majority of U.S. adults are using YouTube. And thinking about more participatory platforms, Facebook is currently the leader overall for the highest percentage of U.S. adults who use Facebook, with most age groups hovering around those 70 to 80%, and even among older adults, so adults 65 plus, use in the mid 40%. So with social media being a real presence in the everyday lives of many U.S. adults and teenagers, but here I'm focusing on adults, it's a really great opportunity to leverage these interactions and these social media habits for public health messaging and to deliver behavioral interventions, and also to conduct observational research to learn about the attitudes, behaviors of people, and also how health information and misinformation spread across online social networks. So researchers have been taking advantage of this really amazing opportunity to understand how people are already using these platforms, and then how, as researchers and public health professionals, we can leverage these platforms for good in terms of health. This graph represents research articles published that are related to specific social media platforms. I mean, you can see sort of an exponential rise in the number of research articles per year published, say about Facebook or about Twitter, over the last 10 years. Searching for the term social media more generally, we found 23 articles published in 2009, 1,058 in 2014, and 2,522 so far in 2019. So this is really something that's becoming more and more popular in terms of thinking about talking about ways to leverage social media in different ways for research. So thinking about some common ways that social media can be used for health research. You can use social media to recruit for trials or observational studies. You can deliver a behavioral intervention either wholly or partly via social media. You can evaluate a social media delivered intervention or public health messaging. And you can conduct various types of observational studies of social media content. Now today, we're really going to be focusing on these last two, so evaluating social media delivered interventions and observational studies using social media content. But I want to touch briefly on these first two. If you are particularly interested in recruiting for trials or observational studies via social media, I'm delighted to say that we have a webinar scheduled in February, on February 10th, on this exact topic. So please register at the mHealth Center website, and please join us in February if you want to hear all about the ins and outs of recruiting for research studies on social media. Next, there's a whole bulk of research now and emerging more and more research on how to deliver behavioral intervention via social media. We, a couple of years ago, wrote a nice paper on how to adapt a behavioral intervention for social media, including sort of walking through the steps of how to do that. We also, Sherry Pagato and Ashley Penzino of the center here a couple of years ago did a nice webinar on the topic, which I have linked to here if you'd like to go watch that webinar if that's something of interest. But getting back to these two here, the things that we're focusing on today, we're really going to focus on talking about ways to collect and then analyze social media data. So both in the context of intervention studies and observational studies. But before we really sort of dive into examples of these types of studies and what you can do with social media data in these contexts, I'd like to ground the conversation just sort of coming back to the scientific process overall. So you can think of the scientific process as thinking about a research problem and a research question, formulating hypotheses, designing a study, collecting data, analyzing that data, and then interpreting the results. You'll notice here I have a couple of asterisks. There is this piece between designing the study and collecting the data, where you'd also need to obtain funding and IRB approval, hire and train staff, purchase equipment, set up tracking systems, and develop study procedures and protocols. And then there is a step after, of course, interpreting results, which is disseminating the results. We do science with the idea of being able to make the world a better place. So, of course, after we interpret the results, we want to disseminate those results. We want to work to implement efficacious interventions. We want to advocate for change. We want to do good with our results. But thinking about this, these steps of defining a research problem and coming up with hypotheses, designing the study, collecting data, analyzing data, and interpreting results, as you're thinking about what type of data you need to collect and how you want to analyze it, it really comes back to your research question. So I've seen people get really excited about the possibilities of social media data, and I've been guilty of this too, being like, ooh, we can do that. Oh, that's so cool. And then you really have to think about it. Okay, so I could collect that data, but what question does that answer? So really coming back to all the time thinking about what is the research problem you're working on, what is your research question and your hypotheses, and then what data do you need, rather than, ooh, there's this cool data, let me just collect it. So really grounding any data collection and analysis project in what the research question is. So, hang on, clicky things. Okay, so first, I want to talk about a couple of examples of how to use social media data to evaluate a social media delivered intervention. So these are two examples from work from our work here at the center, but it could be applied to other topics. The idea here is we may be delivering a behavioral intervention via social media. So in our case, we do a lot of work around weight loss. So you may want to say, okay, well, if somebody's participating in this weight loss intervention, does that lead to greater weight loss? So the first studies of social media delivered weight loss interventions and other behavioral interventions really took a very broad stroke approach to looking at engagement, total number of engagements, so maybe the total number of tweets and retweets, or the total number of posts and comments and likes in a Facebook group, and look to see if that was associated with weight loss. And across several studies, yes, more engagement. People who engaged more were more likely to lose weight or lost greater amounts of weight. What we've been doing in recent years is going a little bit deeper in that and thinking about meaningful engagement. So we define meaningful engagement as types of engagement that leads to the clinical outcome or the behavior that we're most interested in. So in our cases, if we're doing a weight loss study, we want to know what types of engagement are associated with weight loss. So here on the left is an example of a study. It was a 12-week Facebook delivered weight loss intervention. After the intervention, we used a custom script to download the engagement data from Facebook. So posts, including the date of the post, the text of the post, any links to images and who posted it, and any comments on any of those posts, and then also reactions, or actually, it was old enough, just likes on any of those posts or comments. We then did a content analysis of the participant posts and comments to see sort of what types of comments and posts they were doing. So here in this table, you can see the types of comments and posts were reporting a challenge or a slip, asking for help, reporting a healthy choice, responding to a request to have people report their weight change for the past week. And we looked at whether the number of each of these types of posts were associated with greater weight loss. And you can see from this table that some but not all types of posts were associated with weight loss. So this kind of research is using this fine-grained engagement data, so being able to not just look at the total number of posts, but then the types of posts, and help us sort of understand what types of, how people engage in behavioral interventions and how that leads to the behavior change or the clinical outcome that we're looking at. So another way to think about evaluating social media delivered interventions is also trying to improve how we're delivering the content. So the second example, the brightly colored bar graphs on the right, is an example we did using data from a one-arm pilot of a Facebook delivered postpartum weight loss intervention from a couple of years ago. So at the end of the 12-week intervention, we downloaded, again, engagement data and looked at participant replies to intervention posts. So we wanted to get a sense of which posts were better at, which intervention posts were better at engaging participants in conversation, and then which posts really didn't start a conversation. So in order to do that, we need to know for each post who commented on it, or who replied to it, and then how many participants out of the total 19 in this pilot study replied to each post. So we categorized post as no engagement, so nobody replied to it, some engagement, so less than 25% replied, or high engagement, at least 25% of participants replied to it. And as you can see from the red, yellow, and green posts, there were many posts that did not engage people well. But so this is flipping it on its side. So the first approach is to look at, for an individual participant, how is their engagement associated with their outcomes. This is looking at the post level, what types of posts are more likely to engage people in conversation. So thinking about this, in this particular study, our next approach, we took the low engagement posts and we used a focus group and we asked women in the target population, how can we make this post better? Why is this not engaging? What are your suggestions for a way to reformat this to get it to be something that starts a conversation? So the idea here is really using the engagement data in order to better understand, how we can improve treatment delivery in our behavioral interventions. So thinking about, broadly thinking about this type of use of social media data, so evaluating social media delivered intervention. There are ethical considerations. So obviously, if it's an intervention study, IRB approval is required for any intervention study. So we think it's really important to include details in the consent form and discussion, about what data will be collected and what data won't be collected. So for instance, we talk about how anything that people post or comment or react in the intervention group, we will collect that data, but we're not going to go to people's profiles, for instance, and we're not going to be pulling posts out of their regular Facebook stream. We're just limited to what's in the group. I've provided a link here for sample consent forms, and also if anyone is particularly interested, feel free to email me, and I'm happy to share the language in my forms. So another thing to think about here is also, as you're thinking about looking at engagement data from a behavioral intervention, how do you handle suicidal ideation or other participant safety concerns or reportable disclosures that occur in the group? So this also has to do with delivering the intervention, but then also from the data side, if somebody hasn't noticed it during the intervention, how do you handle that sort of content as you're seeing it? Finally, thinking here, what data do you need to answer your research question? So the data that one might need to answer a question about participant level engagement, and if you're just looking at total volume of engagement or specific types of specific types of engagement, that might be a different type of data or different data elements than you might need to answer a question about which intervention posts are more effective at eliciting engagement from participants. So for instance, do you need to know just the total number of participants or users who liked or reacted to a post, or do you need to know who liked or reacted to a post? Those are two different things, and depending on the tool you use to get the data, that may be something that existing tools produce automatically versus you might need to manually abstract it. But sort of thinking through, okay, what are the research questions we want to answer with this engagement data, and then how do we make sure we get the data elements we need? And a little bit later, I'll get back to some of the considerations and challenges in terms of data collection, depending on the social media platform you're using. But overall, thinking about if you're going to be asking questions about evaluating social media delivered interventions, thinking about what is your research question, what data do you need to answer that question. So the second big category of ways we can use social media content, and particularly related to data collection and analysis, are observational studies of social media content. So here I have, on the next two slides, I have several examples of the type of analyses that you can do with with social media data observational studies. So one thing that is very common and can be really useful for understanding things is we can examine what users are talking about around a particular topic. So this may be around a particular hashtag, or maybe around a particular keywords, or another way of getting at a particular topic. So the first example here, content analysis of Twitter chatter about indoor tanning, is a study of ours. So we prospectively collected tweets by searching tanning better tanning salon for 7 days in March 2016. And then we took a random sample of 1,000 posts to do a content analysis of who was talking and what were the kind of things they were talking about. Very briefly, we found that 71% were by indoor tanners, and the topics included positive sentiment about tanning, napping in tanning beds, and some negative experiences tanning, sort of a broad range of things. And interestingly, we also found that only 4% of tweets including a health warning or anti-indoor tanning messages. So this is a way of saying, okay, about this topic, what are people talking about, and who's doing the talking about a topic? The second example, the Me Too movement in the United States, text analysis of early Twitter conversations. This was a study that looked at 12,000 tweets containing the Me Too hashtag from the first week of the movement. And they looked at a subset of the tweets to build a prediction model to categorize tweets in terms of the first-person revelations of sexual assault and whether it occurred in childhood. And then they sort of described what they found here. So here is using what people are saying about a particular movement or a particular event in time, which was, when the Me Too hashtag first became popular, to sort of understand, who's using it and what kind of experiences they're sharing. Studies can also examine the quality of health information or presence of misinformation, or how information is presented and how that impacts user engagement with it. So the next example is a study looking at YouTube videos around infertility. So the researchers identified the 80 most top viewed videos from searching for the term infertility, and then they manually abstracted information about these videos, and then they did a content analysis to code the purpose, tone, and demographics and fertility characteristics of the people talking. And they found that personal videos had more comments and likes than informational videos. But here they're trying to understand sort of what is being said around this topic and who is talking about it and what format are they talking about it. The final example on this slide looked at public diabetes-related Facebook pages. So they manually abstracted 50 posts from the 10 most popular public diabetes-related Facebook pages, and then they coded posts in terms of themes related to illness, self-regulation, and health communication. And then it did a regression analysis to examine post characteristics associated with higher engagement. And so, for instance, one finding they found was that posts with images had higher engagement than posts without images. So here's a selection of ways that you can think about this. So being able to use public social media content to look at what people are saying about a topic, to examine what sort of information is being presented and who's presenting it, and what sort of characteristics of posts are associated with greater engagement. For this last one, you could also imagine if you're doing a public health campaign that you might want to understand if you have a presence or you're trying to disseminate health information, which ways of presenting that information are more effective. There are additional sort of types of analyses and types of questions that you can ask using social media data. So the first one here, Tweet for Health, using an online social network to examine temporal trends in weight loss posts. This is an example of looking at how conversations about a topic change over time, or if there's seasonality in topics. So here, the research team downloaded all tweets in 2012 that included the hashtag weight loss or the term weight plus a related hashtag having to do with diet or physical activity. And they looked at posts that were posted, how many posts were posted during versus before, during, or after holidays, in the winter, in the summer, or right before, right after New Year's. And they found that there were more posts per day on weight loss topics during and after the holidays than before the holidays, and more than in the winter than in the summer. But this is an interesting way that there are definitely some topics that are more seasonal, or sort of either have seasonal patterns or have patterns around certain events. And you can use social media data to sort of look at how conversations are changing over time. Another approach is that you can look at how something is changing over space, or how there's differences over geographic space. So the next study, so Twitter-derived measures of sentiment towards minorities and associations with low birth weight and preterm birth in the U.S. This is an example of a study. They collected 80 million tweets and identified 1.2 million public tweets that had keywords relating to a minority, racial, or ethnic group. Then they used a sentiment analysis to code the sentiment of tweets, so whether the tweets are positive or negative towards a particular racial or ethnic minority group, and then categorized states in the U.S. into tertiles of how positively there were tweets, how positively the sentiment of tweets related to certain racial and ethnic minorities were. Then they linked data to the national vital statistics and looked at rates of low birth weight in those states, and so compared states with higher versus lower levels of positive sentiment towards certain groups and birth weight. And they found higher rates of low birth weight in states with lower positive sentiment towards several selected racial and ethnic minority groups. So here's an interesting way in which taking what people are saying on social media as a public sentiment around a particular topic and linking that to a hard clinical outcome using another sorts of data. Similar to this, also looking at geographic distribution of conversations around a topic. Retweet to pass the blunt, analyzing geographic and content features of cannabis-related tweeting across the United States. Looked at 3 million cannabis-related tweets, and about 30% of which had geolocation information. And they classified the tweets as by a person, media, or retail, and then the sentiment as positive, negative, or neutral about cannabis. And then they grouped states based on their cannabis legislation policies, so recreational, medical, less restrictive, medical, more restrictive, or illegal, and then looked at the types, sort of the bulk and the percentage of tweets that had different positive or negative sentiment, who was posting in states based on their policies around cannabis. And they found that states with less restrictive policy displayed greater cannabis-related tweeting and conveyed more positive sentiment. So this is another example of being able to look at sort of attitudes or experiences across space, and also to use that and compare that to another piece of data. So here about policies. So finally, another example of a sort of a type of analysis that you can do with social media data is to do a social network analysis. So social media is really our online social networks, and we do have information on who is interacting with who. So thinking about ties between people, somebody could retweet. So in this case, they're using Twitter data. So here they looked at a retweet network, but you could also say, okay, did somebody, or is a tie reacting to somebody's post? Is a tie sharing somebody's post? And thinking about different ways that people could be connected. So in this particular study, they looked at 88,000 tweets about Zika or microencephaly, using the Twitter historical API. And they coded tweets using the rumor interaction analysis system and split accounts into and labeled them as propagators versus debunkers based on the proportion of tweets that each account tweeted that expressed a belief or disbelief in various conspiracy theories related to Zika. Then they looked at the retweet network, so connecting users by whether somebody had retweeted somebody else's content, looked at the retweet network structure using the R-package iGraph. And they found that conspiracy theories spread through more decentralized networks and were more likely to ask rhetorical questions. So here they're trying to say, okay, let me understand how people are connected around a particular topic. There's been a bunch of other work looking at polarization related to HPV vaccines and other vaccines, and also political content, looking at how are people talking to people like themselves, or are they talking to people who have different opinions. So looking across these 8 studies that I just used as examples, here we have lots of different types of analyses that people have done using to conduct observational studies of social media content. So for instance, many of the studies using either qualitative content analysis or mixed method, combining content analysis with other types of analytic approaches. Many studies presented simple frequencies, such as the themes resulting from a content analysis. We have studies using standard regression analyses, also sentiment analysis, social network analysis. There's lots of different ways to use these data. I think that there's a lot of potential, as the middle two studies on this slide show, for also combining social network data or social media data with other sources of data to ask richer and more interesting research questions. So thinking about, sort of overall, thinking about conducting observational studies of social media, there are some, of course, ethical considerations with all types of research. So here, I think the biggest ethical consideration is whether you're using public posts only or whether you're using privately posted content. Secondary analyses or observational studies in which you're not interacting or intervening on anyone and you're only using publicly posted content is currently not considered to be human subjects research. Whereas if you're using privately posted content, then it would be considered human subjects research. So thinking about are you using public posts only? Are you using any content that the person is posting privately? So for instance, in an account that is protected on Twitter or with privacy settings on Facebook or in a closed group on Facebook versus completely publicly posted. So if you are using privately posted content, it's a little trickier to think about the best way to go about doing this in a way that is ethical. So you want to think about how you could consent people or how you could set up a situation in which, that it would be appropriate for you to use the data. So really thinking about that. So it's one of those things that I would definitely say if you have any doubt about whether or not your study constitutes human subjects research, I would encourage you to reach out to your IRB and have a conversation with them. It's always better to err on the side of checking first rather than assuming it's not. I think one thing that's important here is just because we can access data from a social media platform doesn't mean we should for research. So for instance, on Facebook, I'm in a couple of closed groups or private groups that my account certainly has access to, but my account has access to as me as a person, not me as a researcher. So if I were to suddenly go tromping into that group and downloading a bunch of posts, that's not ethical because I'm not there. They haven't given me permission as the researcher to look at that data in that way. So thinking about that. With publicly posted data, I feel like we have a strong obligation to protect the people who contribute research data, even if they're not human subjects participants. For example, often with content analyses, we like to provide illustrative examples of particular themes. And even when they're publicly posted, I are on the side of not doing a verbatim post in a publication because then somebody can search that and find the account that posted it. And even though they posted it publicly, I think most of the times the expectation is not that researchers are going to be using their data and they may not want that data called out in that way. So thinking about, is there a way that I can handle my data and handle the presentation of my data in a way that protects people and protects their privacy even if they are posting the content publicly. So again, the next point here is also what data do you need to answer your research question? And so thinking again, exactly what is your research question and what is the best way to get data that will help you answer that question? So one aspect of this to think about is an issue of sampling. So do you want to sample prospectively or retrospectively? How many days are needed or how many posts do you need for the kind of analysis you want to do? So for example, many content analyses are in the 300 to 1,000 post range, whereas a large social network analysis might be 50 or 60,000 posts. So thinking about what sample size you need, what days you want to search. Another thing to think about is the seasonality of the behavior or topic under study. So for instance, we saw this in a couple of slides ago that the hashtag weight loss is somewhat seasonal or has sort of a seasonal variation. There are also other behaviors that, among particular geographic areas, are going to be more common at different times of year. There also you want to think about if you want to purposely include or exclude specific days. So one might be as simple as, do you want to collect data on a weekend or a weekday? Does that matter? Do you want to collect data that purposely includes or does not include a particular holiday? I've seen some really cool research looking at tweets and tweets around a particular disaster. So a hurricane hashtag, what are people using that hurricane hashtag for? In which case you'd want to particularly include those days where the hurricane was active and that was happening. Whereas, if you were looking at something else, you might not want to include a particular day. So for instance, if I'm looking at weight loss, unless I'm interested in what people are eating on Thanksgiving is probably not the best day to randomly pick up the year if I'm interested in what people are eating, for example. So finally, thinking about interpretation and generalizability. So not all U.S. adults or adults not in the U.S. or teenagers, not everyone uses social media and not everyone uses it in the same way. Particularly relevant to this, I think, is that not everyone who engages in a particular behavior tweets about it or posts about it. Some posts are sort of Like we don't know whether they're uncensored and we're seeing really reflection of what people's lives are like, or whether they're only presenting the quote Instagram ready version of people's lives or their experiences. So thinking about, what are we seeing in these posts, and does this reflect people's lives? But also thinking about, who's posting it. So I would say at best, results will be generalizable to people who post about that topic on the social media platform. It's not going to be representative of all adults, and it's not going to be representative of all adults who engage in that behavior. It's really going to be results going to be representative of people who post about that on that social media platform. And so thinking through sort of what that means. So next, I'd like to talk about. Here we go. Sorry, syncing things. So I'd like to talk about how do you go about collecting these data. So again, I know I keep saying this. I say, "What's your research question?" So often my husband made me a mug for Christmas that says, "What your research question?" But really want to, this is one of the key points here, is that what data do you need to answer your research question? I encourage you also to read the platform use policies. For a while, the Instagram use policy said, users may not download other people's photos. So I was trying to find that recently as I was preparing for this webinar, and I couldn't find that language anymore, but it used to say that. And so thinking about when you sit down to conduct a study, what do the use policies say about who's allowed to download data and for what purpose? I'm going to talk about in a minute several free or not super expensive tools, but I would suggest sort of doing an environmental scan for tools or resources to help you download the data. It's a landscape that's constantly evolving. In the years I've been doing this kind of research, tools have come in and been useful and then have no longer worked for various reasons. Another thing to think about is whether there are existing tools that will give you some or all of the data that you need. Pardon me, that's the cough coming in. So for example, in a current study of ours, we get some of the data that we need from an automated tool, and then we manually abstract the rest, and I'll provide details on that in a few minutes. And finally, I would say sort of have a backup plan in mind, and be prepared to pivot in case the platform's API changes. We've seen over the last year and a half significant changes on some of the popular social media platforms, API and access to data policies, and sort of knowing in advance that you may be caught in a shift will help you be able to be agile and be able to handle those changes. So the first tool I'd like to talk about is called Encapture. So it is a free browser extension for Chrome and Internet Explorer, and it's an extension for NVivo, which is a well-known qualitative data analysis software. I have the links here where you can just search for it. So it allows you to download public tweets, data from public Facebook pages. Pardon me, hang on a second. So public Facebook pages, data about YouTube videos, and then importing only as PDFs, but linked in conversations and websites. So it allows you to import the data into NVivo to analyze in NVivo or to export to another statistical software package. So I'm a big fan of NVivo. It's free, it's easy to use, it captures really great data. So for example, with public Facebook pages, it captures the Facebook posts, the user who's posting it, the date, all the comments with the dates and users. With Twitter, it will capture the user tweeting, any links, the post text, the date, the number of likes, and the number of retweets. And also for users who have it turned on, the geography of where they're posting from. Apologize again for the coughing. Not fun. So a couple of things to think about this. So this is great. It's easy. It's free. There are some considerations. So it's not always consistent with the number of posts it downloads or how far back posts are captured, which can be a little frustrating. A thing to note is that you have to authorize it through your social media account. So one thing to be careful of is not capturing tweets from private accounts who have accepted you as a follower. So if I'm following a protected account who has allowed me to follow them, then I have permission to look at those tweets, and that might be downloaded as a public tweet because Encapture sees that I can see that tweet. So thinking about just being careful about that, and perhaps setting up a separate account with no followers to download data. So one thing about the Twitter downloads is that for a given tweet, it captures the number of likes, but not who liked the tweet. So depending on what you're looking for, that may be information that you'll want to manually abstract about tweets versus that may be sufficient depending on what your research question is. One thing that is cool for YouTube is that it captures videos to watch and then code right in vivo, and you can code the videos like each second of the video if you want. So sort of play it right in vivo and then code throughout the video, which again, depending on what you're looking to do, is a really cool functionality. One thing I noticed about the Facebook captures here is that it has a variable for likes, but right now it's all coming through as blank. So I'm suspecting that they didn't update it for reactions. So that's something else to think about. And so if the number of reactions or who reacted to a post that you captured in Encapture is of interest for your research question, you might need to go in and manually abstract it. So that's in vivo, or that's Encapture. So that is a great tool. Also for Twitter data, there's an R package, R tweet, which allows you to search by users, keywords, hashtags. It allows you to get friends or to get all the tweets from a particular user, to get mentions, to get favorite lists, and more. So this, if you know R or you have somebody on your team who does, this is a really handy package for obtaining public Twitter data. You can also use this in different contexts. So an example of how we're using this currently in the center is that we have a non-inferiority trial going on right now comparing a Twitter-delivered versus in-person delivered weight loss intervention led by Dr. Sherry Pagato. And in that, we captured the tweets from the coaches and the participants using Twitonomy, which is a commercial product. But then we wrote a script using our tweet to capture the liked tweet lists for each participant. So here we're interested in, again, looking at this engagement of not, of who is interacting with which content, and we're interested in, for an individual participant, which posts of the interventionist and of the other participants they liked. So we are able to use our tweets and say, okay, here's the user, what tweets have they liked? And here, in this case, we're using the authentication through a user to our advantage. So we log in and authenticate the script through the coach's account, who then is able to see the protected accounts of the participants in our little private Twitter network. So here, this is an example of using this free package to get data from our participants to be able to answer the questions we have about engagement. So thinking about Facebook data, so Facebook and also Instagram, which is owned by Facebook, have recently restricted access to their APIs. Several years ago, we had a great script that would allow us to pull data from our private Facebook groups for intervention groups. And in April of 2018, Facebook massively changed access to their data through their API in response to some of the issues that they were having with misuse of the data from their site. So since then, we've come up with different ways to think about capturing data from these groups. So one option is that there is the Facebook Group Insights tool. Facebook Group Insights tool. This tool is native to Facebook. It only really works for groups that are with at least 50 participants, and the data aren't fully available for at least 30 days after the start of the group. So for some of the interventions that we do, our group sizes are smaller than 50. So for instance, I have an ongoing trial right now where our group is more in the 15 to 20 range, and so this tool is not helpful for us. But if you have a larger intervention group, this can be a good tool to think about. Another tool that we're using, it's a commercial tool called Gridix, and we're using it right now. You do have to pay for it. It is not outrageously expensive, but it's not free. With an account that's the admin of the group, you can download de-identified engagement data from people in your group. If users give permission to the Gridix app to re-identify their data, then you get identified data. So I have chosen actually just to have the coach or the interventionist give Gridix permission and not the other participants. And then we go in and manually abstract which participants made which comments in which posts, and then also which participants liked or reacted to each post and comment. Because Gridix doesn't give us the data on who reacted to each post and comment. And again, I'm very interested in exactly who's engaging with each piece of content in what way. So sort of thinking about that. So this is an example in my current trial of using a commercial tool, so Gridix, combined with manual abstraction. So we take the export from Gridix, manipulate the data a little bit, and then upload it to a REDCap project and have team members log in and then look at the Facebook group and say, okay, this Facebook group, these 3 participants like this post or love this post, and check those off in the red cap form. In terms of Instagram, right now I don't really know of any great free tools right now to automatically collect Instagram data, and their current language in their use agreement suggests that that's not something that they're keen on developing or keen on allowing right now. So last fall, we had written a Python script to collect posts or collect engagement data and post data about a corpus of posts related to diet, physical activity, and weight gain during pregnancy that we had identified by searching for these topics. And since then, changes to the API make it so that script no longer works. Also, looking in the literature, several previous studies had using Netlytic, which is another commercial tool which works for YouTube and Facebook, which works for YouTube and Twitter, but no longer works with Instagram. It looks like, talking to a couple of companies recently, there are some commercial companies that provide some amount of Instagram data, but for some fees that are not feasible on most pilot studies budgets. They would, it would really only be feasible in the context of a much larger budget. But one thing to think about is, again, coming back to your research question, depending on what you're looking to do, if you're interested in using data from Instagram, manual abstraction may be completely feasible. So thinking about doing a content analysis of posts on a particular topic of 500 posts, depending on what data you need, it may be completely feasible to collect those data manually and collect them directly into, say, a REDCap database or another data management tool. So thinking about that. Thinking about Reddit. So I have not done any research using Reddit data, although I've read some kind of neat studies, including a recent one looking at a subreddit conversations called underage Juul users. So some interesting research. So I've looked, these are 2 tools that I've heard about, I have not played with myself. So one is the Python Reddit API wrapper, PRA. So it's a Python package that allows access to the Reddit's API. And then PushShift is a public Reddit archive of public posts, so that you can access the history of public posts from Reddit there if you're interested in using Reddit as a data source. So to wrap up, I have a few sort of take-home points, if you're only going to remember a couple of things from this doc. One is that really thinking about, when you're thinking about what data you want to collect and then how you want to analyze the data, really have it come back to your research question. So really think through, what is the burning scientific question I'm trying to answer, and then what data do I need to answer that, and then how do I want to analyze that data? I would also highly recommend that your team include both the subject matter experts, people with subject matter expertise, and also people with data science or analytic expertise. Really, in terms of thinking about subject matter expertise, a lot of the validity of some of this work, especially looking at observational studies, comes from knowledge of search terms or hashtags or jargon or slang used by the target population. So thinking about how people are talking about a particular topic, what hashtags are people using, what hashtags are they not using, which terms are more of an academic term versus something that the population that your target population or your audience really uses themselves. So really being able to sort of think through that and then put it in the context of what else we know from other research. Also, there's a lot of data management steps and a lot of effort required to turn some of this raw data into information. So that step between data collection and interpreting results, the analytic step, often requires a substantial amount of data management. So it's really important for people on the team to be able to not only interact with the platform or the API, but then also be able to do the data management steps between getting raw data from a platform or a tool and then turning that into a data set to be analyzed. And finally, I'll say it again, the social media platforms, APIs, they change rapidly, so be prepared to adapt. And if you're writing a grant, maybe build in money to be able to switch to manual abstraction or switch to paying for something that previously you didn't have to, and sort of think through, okay, if I suddenly didn't have this access, how could we still get the data we need to answer our research questions and keep our project on track? almost finally, we have an ethical obligation to protect the people who contribute to our research data. So even in the cases of doing a public surveillance project, public health surveillance project using only publicly available posts, we really want to think about how can we conduct this research in a way that doesn't create harm for the people who produce this data, even if they're not considered human subjects in this project. And so thinking about how our work can not hurt individuals, but also how our work can really be beneficial to society and the health of our population. And then finally, have fun. There are some really cool data available, and I think that those social media has really opened up opportunities and possibilities for asking questions and answering questions that was not possible 10 or 15 years ago. And it's a really exciting time to be able to think about what are the really interesting scientific questions that we can ask to help us really better understand how people are engaging behaviors and how people are at risk for disease or managing disease, really understanding that. And so it's a really exciting time. So geek out, enjoy the data, and have fun. And finally, if you're interested in more on social media research, may I direct you to our center website. We also have an annual conference, and it's always in May. So this coming May 14th, 15th. And the topic this year is building an evidence base for commercially available technology. So please, check out the conference agenda and register for the conference. We also have a list of additional webinars this year. Again, the one in February on recruiting participants using social media. We have additional ones this spring on project management and existing large national data sets that have information on technology use, social media, and information seeking. So please check out our website for upcoming events. And finally, for those of you who who are listening, if anyone is interested in coming to work with faculty here at the center, are faculty in the master's and PhD programs in health promotion sciences run out of the Department of Allied Health Sciences, and we are pretty much recruiting students every year. So if you're interested, check out the website and get in touch with us. You'll see my email address and my Twitter handle in the corner if you have any questions. And I don't see any little questions on the online chat. So if you have any questions, feel free to type things in or email me later. Thank you all for attending, and I hope you have a great afternoon.